Millions of people start their day by swallowing over-the-counter pills to manage joint pain. Most are unaware that an active compound found in a common pantry spice matches the efficacy of those pharmaceuticals without the systemic damage. Osteoarthritis occurs when the protective cartilage between bones wears down, triggering a chronic inflammatory response. To mask this pain, patients often become dependent on non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and diclofenac, to suppress the inflammation. Chronic NSAID use carries a steep internal cost. Clinical data identifies these drugs as a leading cause of gastrointestinal ulceration, severe bleeding, and perforation of the stomach wall. In older demographics, these over-the-counter medications can eat directly through the lining of the digestive tract. This forces a brutal compromise. To walk without joint pain, patients are often required to destroy their own digestive systems. The root of curcuma longa, or turmeric, contains a specific bioactive compound called curcumin, the agent responsible for its clinical effects. In 2021, a systematic review and meta-analysis put curcumin head-to-head against pharmaceutical drugs. The researchers found that curcumin was non-inferior to NSAIDs for both pain reduction and physical function improvement. This chart shows the critical difference in safety. Curcumin users experienced 12% fewer adverse events compared to those on NSAIDs, with a safety profile nearly identical to a placebo. While the clinical data proves this compound is a safer, effective painkiller, 99% of users fail to see results because of a fatal biological flaw. Consuming culinary turmeric powder provides negligible clinical benefit. Curcumin comprises only 5% of the raw turmeric root, meaning standard culinary doses fall significantly short of therapeutic thresholds. Even when consuming concentrated amounts, the liver immediately intercepts the compound. In a process called first-pass metabolism, the liver swarms and dismantles the curcumin molecule before it can reach the bloodstream. This is achieved through glucuronidation, a chemical process where the liver neutralizes foreign substances by making them water-soluble for rapid excretion. Because the liver identifies curcumin as an alien substance, it flushes the compound out of the body long before it can reach inflamed joints in the musculoskeletal system. The failure of most turmeric supplements is the direct result of this highly effective biological blockade enacted by our own anatomy. Piperine, the active alkaloid found in black pepper, provides a biochemical bypass for this filtration system. Adding just 20 mg of piperine actively suppresses the liver's glucuronidation process. This allows the curcumin molecules to remain in the bloodstream for a significantly longer duration. This graph shows the impact. When piperine is introduced, curcumin bioavailability spikes by 2000. This creates a dangerous pharmaceutical interaction for anyone taking anticoagulant drugs like warfarin, Plavix, or aspirin. Combining these treatments increases the risk of severe bruising and catastrophic internal bleeding. Furthermore, curcumin stimulates gallbladder contractions, making it unsafe for those with gallstones or bile duct obstructions. Curcumin is a legitimate biological challenger to pharmaceutical painkillers, but its effectiveness demands the same caution and precision as a prescription drug. Imagine a pain that's always there, a constant nagging ache in your joints that dictates every single move you make. Turning simple things, like walking up the stairs or just opening a jar, into a daily battle. Now, what if the go-to solution for that pain, the one everyone uses, actually came with a really dangerous price tag? Well, this isn't some hypothetical, it is the daily reality for hundreds of millions of people. Just look at this number. Worldwide, over 400 million people are suffering from knee osteoarthritis alone. Let that sink in for a second. That's more than the entire population of the United States, all wrestling with a condition that can erode not just their cartilage, but the very quality of their life. For decades, the main weapon we've had against this pain is a class of drugs called NSAIDs, non-steroidal anti-inflammatory drugs, things like ibuprofen or naproxen, and sure, they offer relief, but it's a dangerous trade-off, especially if you're using them long-term. We're talking a serious risk of gastrointestinal bleeding, kidney damage, and even major heart complications, so it begs the question, right? What if there was another way? A natural, potent alternative that could match the power of these drugs, but with way fewer side effects. Well, if you are ready to explore that science-backed alternative, you are in exactly the right place. Because over the next few minutes, I'm going to walk you through the complete non-pill protocol that turns a common kitchen spice into an absolute powerhouse for pain relief. We are going to break down the hard science, look at the clinical trials, and I'll give you the exact methods you need to unlock its true potential. But hey, before we jump into the solution, it's absolutely crucial that we understand just how serious the problem really is. To truly appreciate the power of this natural approach, we have to start with the hidden dangers of arthritis and the treatments we've been relying on for years. Look at this. For more than half of everyone who suffers, a staggering 53%, this isn't just about dealing with some occasional pain, it is a debilitating condition. That number, it represents a profound loss of independence, people giving up their hobbies, a daily struggle with the simple mechanics of life. This is so much more than wear and tear. It's like a chronic, low-grade inflammatory fire that can just systematically dismantle a person's mobility. And the conventional relief? Well, for so many people, especially our parents and grandparents, it comes at a ridiculously steep cost. Long-term NSAID use is linked to a genuinely frightening list of problems. We're talking about internal bleeding, kidney failure, heart complications, you name it. And for those over 60 who often have thinner stomach linings, the risk of developing painful peptic ulcers just skyrockets. This is not a sustainable solution. For many, it's a ticking clock. So if the standard approach is so full of risk, what is the alternative? Well, the answer might be closer than you think. In fact, it's probably sitting in your spice rack right now. Let's talk about turmeric, and more specifically, its incredibly potent active compound, a little something called curcumin. Now, to understand how curcumin works its magic, you really only need to know about this one molecule, NF-kappa B. The easiest way to think of it is as the master alarm switch for inflammation in your body. In a healthy body, that switch is off. But in an arthritic joint, it gets flipped on and it gets stuck there, basically screaming at your cells to launch a full-blown inflammatory assault against your own tissue. And once that NF-kappa B switch gets flipped, it kicks off this absolutely devastating chain reaction. It releases a flood of pro-inflammatory messengers. And these messengers, well, they then unleash an army of cartilage-degrading enzymes. I want you to think of these as tiny demolition crews that are literally programmed to chew away at the healthy cartilage that cushions your joints. This is what leads directly to the damage, the pain, and the loss of function. And this is where curcumin comes in. Its superpower is its remarkable ability to get in there and flip that master alarm switch right back to the off position. By directly inhibiting that NF-kappa B pathway, it stops that entire destructive cascade before it can even get started. It doesn't just mask the pain, it goes right to the source of the inflammation at a molecular level. Okay, time for our first check-in. If you're finding this scientific breakdown useful and you're ready to see how this little molecule stacks up against a common painkiller, do me a huge favor and smash that like button. It really lets me know you're getting value from this. Now, let's look at the head-to-head clinical evidence. And this is the kind of data that, when I first saw it, I was genuinely blown away. A major clinical trial put curcumin to the ultimate test. They gave one group of patients with significant knee pain 1 to 200 milliliters of ibuprofen a day, and the other group got 1 to 500 milliliters of a curcumin extract. And the results? They were stunning. The curcumin group had improvements in pain and function that were statistically identical to the high-dose ibuprofen group. A natural spice extract matched the power of a major drug. But here's where the story gets even better. While the pain relief was the same, the side effects were not even in the same league. A staggering 38% of patients taking ibuprofen reported side effects, mostly stomach pain, and in the curcumin group, only 13%. So let me ask you, if you could get the exact same relief with a fraction of the risk, why on earth wouldn't you at least explore that option? And there was another totally unexpected benefit. In a separate study, patients taking curcumin lost an average of nearly 2% of their body weight in just 4 weeks. Now, for a 175-pound person, that means 14 fewer pounds of pressure on their knees with every single step. So you get a chemical anti-inflammatory and a mechanical advantage all rolled into one. But wait, there's a crucial piece of this puzzle that most people totally miss, and it's the very reason why just eating more turmeric from the grocery store won't do a thing. Stay with me, because understanding this next part is the absolute key to making any of this actually work. Okay, this brings us to what might be the most important part of this entire explainer. See, you can have the most potent molecule in the world, but if you can't get it to where it needs to go in your body, it's completely useless. We need to talk about how to unlock turmeric's true power. This is the question that trips almost everyone up. If this stuff is so powerful, why can't you just sprinkle some on your dinner and call it a day? It's a fair question, right? Well, the answer is something called the bioavailability paradox. And it's actually fascinating. Your body, specifically your liver, is just incredibly efficient at its job. It sees curcumin as a foreign substance and works like crazy to process and get rid of it before it ever has a chance to enter your bloodstream. It's like your body has a bouncer at the club door that just kicks curcumin out before it can get to the party happening in your joints. Now, what's really cool about this slide is that it's our cheat sheet for outsmarting our own biology. There are 3 keys. First, piperine, which is the active compound in black pepper. It basically tells those liver enzymes to take a break, increasing absorption by an incredible 2000%. Yes, 2000. Second, healthy fats. Curcumin is fat-soluble, so mixing it with oil, like coconut or olive oil, lets it get absorbed differently, completely bypassing that bouncer in the liver. And third, a little bit of heat, which makes it much easier to dissolve. So now that we know the what and the why, let's get down to the how. This is where we take all this amazing science and turn it into a practical daily protocol that you can actually use right from your own home. This right here is the gold standard for non-pill turmeric therapy. It's called golden paste. And I've tried this myself. It's actually surprisingly easy to make. You just simmer turmeric powder in water until it forms a thick paste. Then, and this is important, you take it off the heat and you whisk in your healthy fat and some freshly ground black pepper. This simple process hits all 3 of our absorption keys: heat, fat, and piperine, all in one concentrated dose. You just store it in the fridge and start with about 1 to 2 teaspoons a day. Seriously, this recipe is a total game changer, and I am genuinely curious. Comment below if you're going to try making it. And hey, if you're serious about taking control of your health naturally, you should definitely subscribe so you don't miss our next in-depth guide. But what if your pain is really localized, like just in your hands or your knees? Well, you can also use turmeric topically, which lets you bypass the digestive system entirely. You can make a simple massage oil for your hands and feet, or for deeper joints like your knees or shoulders, a warm poultice made from turmeric powder, water, and some castor oil can provide really profound targeted relief. Now, what's truly remarkable about tackling inflammation this way is that the benefits, they don't just stop at your joints. You see, chronic low-grade inflammation is a primary driver of so many modern diseases, so when you treat your arthritis, you often get this amazing ripple effect of other health improvements. The science shows that what's good for your joints is also fantastic for your heart, your brain, and your metabolism. Studies have shown curcumin can help reduce triglycerides and bad cholesterol, improve memory in older adults, and even improve your body's sensitivity to insulin. So by targeting inflammation, you're not just helping your joints, you're really investing in your overall long-term health. Okay, before you rush off to your kitchen, we absolutely need to have a critical conversation about safety. Please listen very carefully to this next part. While this is a natural compound, you have to remember that natural does not mean it's without powerful biological effects, especially when you're taking it at these therapeutic doses. I really need you to pay very close attention here. This isn't a suggestion, it's a critical warning. For anyone who is on blood thinners like warfarin, Plavix, or even a daily aspirin, understanding this next part isn't just helpful, it is potentially life-saving. Here's the deal. Curcumin has mild blood-thinning properties on its own, so when you combine it with prescription anticoagulants, it can amplify their effect, creating a high risk of increased bleeding. It can also naturally lower blood sugar, which could be very dangerous if you're also taking diabetes medication. And I cannot stress this enough, this is not a complete list, and it is absolutely not a substitute for medical advice. If you are on any prescription medication, you must always talk to your doctor first. Your health is paramount, it's everything. If this explainer has provided some real clarity for you, please consider sharing it with someone you care about who might be struggling with chronic pain. Their safety could literally depend on it, and make sure you turn on notifications so you never miss another critical health update like this one. So let's bring this all together. The goal of this entire protocol, the science, the pace, the safety checks, it isn't just about making a pain score a little lower on some chart, it's about functional longevity. It's about dampening that inflammatory fire so you can get back to gardening or playing with your grandkids, to reclaiming an active, vibrant life that isn't dictated by pain anymore. So I want to leave you with this one question. You now have the science and you have the step-by-step strategy. So what is the very first step you are going to take to reclaim your mobility and your life from chronic pain? Thank you so much for joining this deep dive. I really hope you found it empowering. Don't forget to like and subscribe for more, and definitely check the description for a link where you can download the full safety checklist we just talked about. Stay curious, stay informed, and I'll see you in the next explainer.